Well, we're going to talk more about this. First, we're just going to take a look at the very latest statistics because we've had the latest NHS England data about the breakdown of vaccinations generally, who is having them, who is getting them, and also including a breakdown by ethnicity. So let's just talk about the latest figures. First of all, with Robert Cuff, who is our head of statistics. Let's start with an overview. Robert, what does the data tell us about how the overall vaccination programme is progressing?
I think barrelling along good guns is the best way to put it. The latest figures from NHS England suggest they're vaccinating more than 2 million people in a week. So that's kind of heading towards that 15 million by the middle of February that the government said as a target a while ago. And when you look at the kind of the target groups that they're hoping to reach, that's different by nation. In England, they've reached maybe 80%, almost 80% of people over the age of 80. That's up by about a third on the week. Scotland are doing it slightly differently. They published their data yesterday. They're prioritising people in care homes, and they're 95% of the way there. So progress is moving apace, I think, towards getting those most vulnerable people vaccinated. A slight wrinkle in England, maybe, is that in London, we're still seeing a bit of a lag. So as I said, about 80% of the over 80s across England have received their first dose of the vaccine. But in London, that figure is a good bit lower. It's down at about 64%. So there's maybe still further to go there.
OK, that's interesting. And how much detail do we get, can we get about breakdown across ethnicities?
Well, the data that we've got probably doesn't get us that much further than the Open Safely study that Adina was talking about from earlier this morning. Because what the NHS have published in the data today is how many people in every different ethnic group have received a first dose of the vaccine. But the trouble is, if we're targeting over 80s, well, you know, the black community, Asian people, there are fewer people in those groups who are over the age of 80. So just looking overall at how many people in that community have received the vaccine doesn't really give us a sense of what the uptake is like or what the coverage is like. So unfortunately, it's a start to the data, but it's not really solving the problems that are complicated, as Adina said, by kind of the suggestion of vaccine hesitancy in some communities.
Right. OK, thank you very much. Robert Cuff there with all the latest figures that have just come through. Let's discuss the uptake generally with Maurice Mcleod, who is CEO of Race on the Agenda, a social policy think tank. He's also a Labour councillor. Hello, very good afternoon.
Hello, Jane.
Your thoughts about the uptake? I mean, I hope you were able to hear our head of statistics there, but your thoughts about take-up of the vaccine thus far?
I did hear. I thought he made some really good points. I think while we're talking about sort of vaccine hesitancy, and I think it's good to be aware of levels of trust within particular communities, we need to be clear about who's actually been offered the vaccine so far, and making sure that areas with large BME communities are actually getting the supplies that they need. It was interesting that I think you said London is lagging behind some of the other places in terms of the percentage of people who've been offered or who've taken the vaccine. So we need to be a little bit careful when we talk about hesitancy, I think.
OK, I mean, yes, London, I think Robert was talking about people over the age of 80. So it's a high proportion for most of the country, but it's more like 64% in London. So that's an interesting discrepancy. And of course, it would be fascinating to know why. From all the work you do, from people you talk to, is there absolutely no doubt in your mind that there is hesitancy in some quarters? I mean, there are people who could potentially be phoned up, say, great news, it's you can come for a jab next week, and they just don't want to go and do it.
I think, to be honest, there are people like that from all communities.
Oh, sure, yes.
It's a new drug, so it's understandable that people are a little bit nervous, and there is a lot of unfortunately misinformation flying around on the internet. But let's also be honest, when we're talking about black communities in particular, there are reasons why they would be a bit cautious when it comes to dealing with the health system or any system, to be honest. As I think was said earlier, black women are 5 times more likely to die in childbirth than their white counterparts. they're 5 times more likely to be to be sectioned in the mental health service than their white counterparts. So there's a history of built up mistrust, I'm afraid, when it comes to dealing with health services.
And I mean, and you've articulated that so clearly. I mean, and what could be done, or what would you like to see done to get the word out to everyone, wherever they are, whoever they are, when the time is right for them to have their inoculation? How can that message be got through, given that lack of trust that you're describing?
Yeah, I think one of the things that needs to happen is need to realise how trust works. So we trust the people that we know, the people that you see every day. I think a lot more funding, a lot more of the emphasis needs to go on local GPs, people that you know, that you see, every week when you go and see them. That's where the government should be, I think, focusing its funding. And let's be honest, those, especially in deprived areas, local health services have been underfunded for years. So we're not even starting from a level playing point.
Well, and heartbreakingly, we know that members of the BME community are more at risk. I mean, we've talked about that so many times over the course of the pandemic, more likely to be in frontline jobs where you can't work from home. I mean, that's all true, isn't it?
Absolutely. I mean, there's so much data now about why this figure of 4 times, black people are 4 times as likely to die as white people. But most of it's seeming is down to where we live, how we work, were or weren't protected, especially in the early days. So there's a lot of number crunching to go on, and we shouldn't sort of take things at face value sometimes.
Maurice Mcleod, we have to leave it there. Sorry about that. Thank you very much for your time, though. Thank you, CEO of Race on the Agenda. Thank you.